Rising alcohol use among women fuels surge in liver disease. What you need to know. Alcohol-related liver disease is on the rise, and it's affecting more women than ever before. In fact, cases have more than doubled in the U.S. over the last 2 decades. But here's where it gets controversial. The increase is linked to 4 groups that make up a greater share of heavy drinkers than they did 20 years ago. These groups include women, adults ages 45 and older, people living in poverty, and those with metabolic syndrome. Metabolic syndrome refers to a number of conditions, including high blood pressure, blood sugar, and cholesterol, that increase the risk of heart disease, stroke, and type 2 diabetes. But why are these groups drinking more? Some experts believe it's become more socially acceptable for women to drink as much as men, while others think older Americans are less likely to understand the hazards of alcohol. The findings provide the first comprehensive look at the demographics of heavy drinking and their relation to liver disease since the 1990s. Because the average drinking rate in the U.S. was unchanged over the last 20 years outside of the pandemic, it suggests factors such as changing health and demographics may be playing a role. Researchers analyzed data from the National Health and Nutrition Examination Survey of adults and children in the U.S. from 1999 through 2020. They tracked the total increase in significant liver disease, a point when scar tissue impairs the organ's function, often caused by heavy drinking. More than 51,600 adults died from liver disease in 2020 in the U.S. The researchers looked at the demographic and health profiles of adults aged 20 or older who drank heavily. 8 drinks per week for women and 15 for men, according to the Centers for Disease Control and Prevention. Previous research had tied the 4 groups looked at in this study to a higher risk of liver disease when exposed to alcohol. And this is the part most people miss. A separate 2024 study found that heavy drinking rose at the pandemic's peak and continued for 2 years after that. The study's author hypothesized that increase may have been due to stress. Liver disease deaths have also roughly doubled over the last 20 years. And the number of annual alcohol deaths due to cancer has doubled in the same time period. The results will help to provide doctors with necessary updates to better treat patients and potentially result in more screenings and interventions for Americans in high-risk populations. As the study's author puts it, our results show that the makeup of the American public with heavy alcohol consumption has changed compared to 20 years ago. But what do you think? Is it really becoming more socially acceptable for women to drink as much as men? And are older Americans truly less likely to understand the hazards of alcohol? Let us know your thoughts in the comments below. The alarming rise of alcohol-related liver disease in America. In the past 2 decades, the incidence of liver disease linked to alcohol consumption has skyrocketed, more than doubling in prevalence. This alarming trend is particularly pronounced among 4 specific groups: women, individuals aged 45 and older, those living in poverty, and people suffering from metabolic syndrome. These demographics appear to be significant contributors to the rising statistics. Los Angeles. A recent study conducted by Keck Medicine of USC reveals that Americans who engage in heavy drinking are now over twice as likely to develop serious liver conditions compared to their counterparts from 20 years ago. This research, published in the journal Clinical Gastroenterology and Hepatology, serves as a crucial alert regarding the severe risks associated with excessive alcohol consumption. Dr. Brian P. Lee, a hepatologist and liver transplant expert at Keck Medicine who led the study, stated, "Alcohol-related liver disease is the leading cause of liver-related fatalities, and these findings should serve as a significant wake-up call about the perils of drinking." The study provides valuable insights into the changing demographics of American drinkers, highlighting that the proportion of heavy drinkers has increased among 4 key groups over the last 2 decades. These groups include women, adults aged 45 and older, individuals living in poverty, and those with metabolic syndrome, a combination of conditions that elevate the risk of heart disease, diabetes, and stroke. Previous research has already linked these demographics to a heightened risk of liver disease when alcohol is consumed. Dr. Lee emphasized this research represents the first thorough examination of heavy drinking demographics and their connection to liver disease since the 1990s. It offers critical insights into which population segments may require more focused interventions to reduce alcohol consumption, potentially explaining the ongoing rise in liver disease. Interestingly, the study found that the average alcohol consumption rate in the United States has remained stable over the past 20 years, prior to the COVID-19 pandemic. This suggests that factors beyond mere alcohol intake, such as evolving health and demographic trends, may be influencing the increase in liver disease cases. Our findings indicate a shift in the profile of heavy drinkers in America compared to 2 decades ago, Dr. Lee noted. The research team analyzed data from the National Health and Nutrition Examination Survey, which evaluates the health and nutritional status of both adults and children in the U.S. from 1999 to 2020, the latest year for which complete data is available. They focused upon the overall rise in significant liver disease, a condition characterized by the formation of scar tissue in the liver that disrupts its function, often resulting from heavy drinking. The study specifically looked at adults aged 20 and older who engage in heavy drinking, defined by the Centers for Disease Control and Prevention as 8 drinks per week for women and 15 for men. Dr. Lee is optimistic that the results of this study will equip healthcare providers with the necessary information to enhance patient care and hopes it will lead to increased screenings and interventions for those at high risk. Jennifer Dodge, an associate professor of research medicine and public health sciences at the Keck School of Medicine of USC, also contributed to this study. This research was made possible through funding from the National Institute on Alcohol Abuse and Alcoholism, under grant number K23AA029752. These findings build upon Dr. Lee's earlier work, including a study from February 2025. That indicated heavy drinkers with conditions like diabetes, high blood pressure, or increased waist circumference face double the risk of developing advanced liver disease. Additionally, a November 2024 study revealed that heavy drinking surged during the peak of the COVID-19 pandemic and persisted for 2 years thereafter. Medical update: liver disease, Alzheimer's breakthrough, and contraceptive aid. Breaking medical news. The latest morning update unveils some impactful stories that not only inform, but also compel us to think deeper about the direction of healthcare today. First, a recent study from Keck Medicine of USC reveals a dramatic surge in alcohol-related liver disease across the U.S., where the condition has more than doubled over the past 20 years. Even though overall alcohol consumption has remained fairly consistent, shifts in the population, particularly among women, adults older than 45, people living in poverty, and those with metabolic syndrome, are largely to blame. This alarming trend, detailed in the journal Clinical Gastroenterology and Hepatology, highlights that the issue isn't just about drinking more, but also about who is drinking, raising critical questions about whether our current healthcare strategies are adequately addressing these vulnerabilities. But here's where it gets controversial. Are these rising cases a clear call to overhaul preventive measures for at-risk groups, or do they simply mirror deeper socioeconomic challenges? Moving on to another groundbreaking advance, researchers at Wake Forest have tested an innovative nasal spray designed to deliver Alzheimer's medication directly to memory-related regions of the brain. According to a PET imaging study published in Alzheimer's and Dementia, intranasal insulin not only reaches crucial brain areas, but does so safely, though the absorption rates differ among patients experiencing mild cognitive impairment. This novel method could revolutionize how Alzheimer's treatments are administered, offering a less invasive alternative compared to current methods. And this is the part most people miss. Could these differences in drug absorption pave the way for more personalized treatment approaches in the future? Lastly, in a decision that has sparked fierce debates, the Trump administration has announced plans to destroy nearly $10 million worth of long-acting contraceptives, the very supplies earmarked for women in global aid programs. Justifying the move with restrictions tied to abortion-related funding, officials claim that this measure is part of a broader policy shift concerning USAID. However, Critics argue that this decision is both wasteful and potentially dangerous, noting that it could exacerbate shortages in at least 10 countries and worsen the risks of unintended pregnancies and maternal mortality worldwide. So, what do you think? Is this a necessary policy reform to align with funding restrictions, or is it a perilous misstep with far-reaching negative consequences? These developments underscore a pivotal moment of change and controversy in medical science and public health policy. What's your take on these issues? Join the conversation and share your perspective in the comments.